My background is in critical care, and I worked throughout the pandemic in the ICU directly caring for COVID patients. After 18 months of chaos, I left the bedside because I could not watch one more of my patients needlessly die due to deadly hospital protocols and the denial of life-saving medications. They were telling us that COVID was killing all of our patients, but I contend that this was not the case at all. But instead, it was the complete and total medical mismanagement of COVID that was killing them. If patients were dying of the virus itself, then why were we not pulling bodies from homes and off of the streets en masse? The reality is that patients, they're not dying at home. They're not dying on our streets. They are dying in our hospitals, and it is time that we start asking ourselves why. I walked away, but if there is one thing that still haunts me from my time working at the bedside, it is the faces. The faces of the patients that I knew didn't need to die. I can't get them out of my head. I had never been really comfortable with death. But you quickly begin to understand that death is a part of life. It comes for all of us eventually. And one of the first things I learned in nursing, especially working in the ICU, is that there are fates far worse than death. I considered it an honor to be able to provide compassion in a patient's last moments, to care for them. But this was different. These patients, they didn't die from a disease. They didn't die from a virus. These patients died in a hospital Holocaust, and this shamelessly corrupt system used its well-intentioned nurses to carry out their sinister plan. The ventilators, they're the new gas chambers. I walked away, but not before I witnessed numerous alarming signs that these novel vaccines were causing great harm to my patients.